A classic surgeon's knot consists of two throws at the base with a single throw on top of it. We'll begin by orienting the suture such that the down thread, which is purple here, lies in my active left hand. I will now be performing the going up throw but create 1 and 2 loops of the white thread of the suture around my fingers. I now complete the throw by flexing my middle finger, catching the purple thread, pinching it between the middle and ring fingers, and then pulling it across the loops, crossing my hand. We now have a single layer of 2 half hitches that lies flat. To complete the surgeon's knot, we need to add another half hitch on top, which we will do with the usual coming down throw. The double throw to begin a surgeon's knot can also be performed with a coming down throw in a similar fashion. Here, I'm holding the up thread in my active left hand. We create an arrow away from us. I form 1 and 2 loops of the purple thread around my fingers. I flex my middle finger and then extend it out, catching the white thread, pinching it between my index and middle fingers, and then pull it through the loops to cross my hands. The base of the surgeon's knot is now complete, and I will end this with a going up throw.